So hello, ladies and gentlemen. You're very welcome to this session, this introduction to Neptra. Greetings from the land of the permanent grey cloud to the land of the long white cloud. My name is Ronan Fitzgerald, veterinary surgeon with the Global Technical Marketing team, which is part of the Pet Health Group in Elanco Animal Health. And it's my pleasure to share some thoughts with you on the subject of Neptra. Now, what I hope to do during the course of this presentation is to look at two key areas. Firstly, to look at this unique combination of active ingredients, and then to look at the convenience that the product brings. So why was Neptra developed? Well, we recognized that Otitis externa is a leading cause of visits to the vet, and also that dog owners may struggle to give a full course of ear medication. And we know that vets can be frustrated with the poor owner compliance. So the intention was to introduce a narrower spectrum product that would address these concerns and the majority of Otitis externa cases seen in general practice. So what we were striving to achieve with Neptra was something that would give guaranteed compliance. That was a one-dose treatment that was easy to use and which would work for most cases. Now we know that Otitis externa treatment can be challenging. A dog owner survey was carried out a couple of years ago looking at 2,000 dog owners from across Europe. And they were interviewed about the difficulties of complying with treatment regimens. And some of the comments are captured here, and some of the findings. Over half, 55% of owners find it difficult to give ear medication twice daily to their dog for 2 weeks. The majority, 70% of dog owners, would prefer a single dose application given by the vet over home treatments for a longer period of time. And for 4 out of 5, 86% of owners, reducing stress for their dog is a priority when treating ear infections. It's also worth noting that even if a client is able to administer a product, they may still prefer to have that responsibility lifted from their shoulders and for the vets to do it if that's possible. So we know that infection is a major aspect, a major component of Otitis externa. In New Zealand, Neptra is licensed for the treatment of Otitis externa in dogs associated with susceptible strains of yeast, Malassezia pachydermatis, and bacteria, Staphylococcus pseudointermedius. And infection is a frequent finding in cases of Otitis externa. Here we have a video otoscope image of the horizontal ear canal. And what we can see here is we have hyperplasia and we have stenosis of the canal. And we have a copious amount of this tan-colored discharge, this exudate. You can also see a sort of a cobblestone appearance in the canal. Now, this is suggestive of ceruminous gland hyperplasia. And this in turn can be caused by the presence of Malassezia. So we can see here that we probably have a staphylococcal infection with this exudate, but we may also have Malassezia as well. Now, when it comes to diagnosing Otitis externa, the trinity is really taking a good case history, examination of the ear with an otoscope, and cytology and culture and sensitivity. Here we have another view down the ear, and looking at the ear, examining it, that in its own right, before we even get to cytology, before we even get to culture and sensitivity, can tell us an awful lot. Again, this is taken from video otoscope footage, looking down the horizontal canal. We have severe erythema, and you can see, again, a tan-colored exudate that's present. We have the canal is edematous, it's narrowed. It would make it difficult to visualize the tympanic membrane clearly. And once again, we can see this cobblestone appearance. As I mentioned just now, this could be suggestive of the presence of malassezia. But the other thing is, if this were to be a spaniel, for example, they are prone to ceruminous gland hyperplasia. So there's a lot of information that we can get just by looking down the ear. And of course, we're looking out for other causes of otitis externa. Ear mites and grass seeds are two examples which would be classed as primary causes of otitis, where their presence can actually initiate the inflammation of the ear. Cytology is another key aspect of diagnosing otitis externa. Examining the exudate is simple, quick, and inexpensive, and it should be performed on every case presenting with clinical signs of otitis externa. It allows the clinician to confirm or rule out the presence of infection, and it allows the clinician to characterize the infective agent. So, do we have yeasts and or bacteria present? If bacteria are present, are we looking at rods or cocci? And this helps to guide our choice of treatment. Now, the presence of rods is an indication for culture and sensitivity to be carried out, because we need to know the sensitivity of this particular pathogen. Culture and sensitivity has its place, and certainly if we see rods, this is a situation where we'd be thinking about doing that. Cytology is also useful to monitor the response to treatment, particularly for chronic infections. It enables us to have a yardstick comparing what we saw last time with what we see now. So it's a very useful way of assessing progress. And something else that examining the ear and cytology allows us to do is to determine whether or not we have biofilm formation. Biofilm formation is something of a hot topic at the moment. We know it can occur in situations where we have orthopedic implants, but there's a lot of talk now about biofilm formation in the bladder, and indeed in the context of otitis externa as well. And biofilm is important because it forms a protective matrix, which makes it harder for our topical products to actually get access to the pathogens we're trying to eliminate. And as it happens, malassezia is a very efficient biofilm formation, as indeed is Staphylococcus, and indeed so is Pseudomonas. So the presence of biofilm makes it much harder for our topical products to get to the organisms. So it's something that we really should be mindful of and be looking out for. So what is the role of culture and sensitivity in otitis externa? Well, we've said that examination of the ear with an otoscope and cytology are very important. Culture and sensitivity is used alongside cytology. And certainly, if we saw the presence of rods, if we saw the presence of a gram-negative infection, we would really want to know what we had and what it was sensitive to. One of the things, of course, with culture and sensitivity is that it's perhaps less useful, less appropriate in the context of an ear infection. Culture and sensitivity is really looking more to that situation with systemic treatment. Whereas if we treat an ear infection, of course, we're using a product and using high levels of antibiotic, which to a certain extent makes the whole discussion around exceeding the MIC somewhat superfluous, because you're putting in high levels of active. But certainly culture and sensitivity has a part to play in the diagnosis and management of otitis. So we do need case history, very important, otoscopy and cytology, and that really is that core, that trinity. But as I said, there are certainly situations where culture and sensitivity will be required as well. So what is Neptra? It's a combination of 3 active ingredients in a unique formulation that delivers treatment in one application. So we have Florfenicol, which is an antibacterial agent with activity against gram-positive pathogens, including Staph pseudointermedius. We have Terbinafine, a powerful allyl amine antifungal agent to address Malassezia species. And mometasone, a high-potency corticosteroid to address the inflammation and pruritus of otitis externa. I'd just like to give a high-level overview of Neptra here. So it's for topical, for otic use. It's a clear liquid, and it's a single treatment. That's one dose per affected ear, and it's a restricted veterinary medicine. The recommended dosage is one single dose container, i.e. 1 ml of solution per infected ear, and this is intended to treat dogs of all sizes. The product should be administered by veterinary personnel, and if needs be, the treatment may be repeated after 30 days, and refrigeration of this product is not required. We have 10 by 1 ml tubes in each box, and you would keep it at room temperature. Shake the tube before use, and it's important to clean the ear before use. Something else to note is that it should not be used in dogs with a ruptured tympanic membrane. And this is true really for all the topical ear products. They should not be used if that eardrum is damaged. Caution should be taken to prevent the product from getting into the eyes of the dog being treated. In case of exposure to the eye, rinse with plenty of water. Caution should be taken to prevent the product from getting into the eyes of the person administering the product, and likewise, in case of exposure to the eye, once again, rinse with plenty of water. Do not use in cases of hypersensitivity to the active substances, to other glucocorticoids, to other corticosteroids, or to any of the excipients. Should not be used in pregnant or breeding animals or lactating bitches because safety has not been evaluated in these particular dogs. Do not administer orally. Do not use in other species. Do not use in cats. Should be used with caution in dogs with hepatic impairment or endocrine conditions due to corticosteroids. So one will be thinking here diabetes, hypothyroidism, for example. Do not use in dogs with generalized dermaticosis, and the safety of the product has not been established in dogs less than 3 months of age. What I would like to do is to share with you the results of field studies that were carried out in the USA and in the European Union. So first of all, the American field study. This was a multi-center, negative controlled field study conducted over 30 days according to good clinical practice guidelines. And the study endpoint was clinical scoring of the common clinical signs of infection that cause dog owners to seek your care. So erythema, exudate, swelling, and ulceration. Each one of these is assessed and each one is given a score. These are client-owned dogs with bacterial and or fungal otitis externa confirmed by clinical signs and culture. The dogs were evaluated on days 0, 7, 14, and 30. And each affected ear was given a subscore based upon severity, 0 being none, 1 mild, 2 moderate, 3 severe. And what they did was they would create a total clinical score, which was the sum of each of the 4 subscores, those signs I mentioned earlier. And for a dog to be admitted to the study, a total score greater than or equal to 6 out of 12 was required for a dog to be enrolled in the study. Now, treatment success was defined as a clinical score of less than or equal to 3 out of 12 on day 30, with no subscore getting worse at the day 30 assessment. So not only did the score have to come in at 3 or less out of 12, but if any one of the subscores had actually worsened by day 30, that would be a failure. So in the study, Neptra, or Claro, as it's called in the USA, was compared with a placebo, and this is the vehicle control, so the product without the active ingredients. And what we can see is that the success for the Neptra group, the Claro group, where the score came down to 3 or less, the success was 72.5%. And the failure, where that score had exceeded 3, was 27.5%. For the dogs receiving the placebo, the success was just 11.1%, but the failure was 88.9%, and the success rates of the 2 groups was indeed significantly different. So if we look at these results, just showed in a graphical form. So this treatment success was defined as substantial alleviation of otitis externa based on the improvement in the clinical severity score at day 30. And we can see that there is a substantial difference, a significant difference in terms of that success for the Neptra group compared to the control group. And of course, it's a field study, so you're also looking at safety and tolerance as well as efficacy. And the analysis included looking at adverse events reported by the pet owner, as well as hematology, serum biochemistries, urinalysis, and a qualitative hearing evaluation. Few adverse events were observed, and these were not considered attributable to the study drug. Changes in chemistry and hematology parameters were within normal range and determined as being not physiologically relevant. So it was possible to conclude that the product was well tolerated in a well-controlled field study on dogs with naturally occurring otitis externa. And this result represented, both in terms of efficacy and safety, it was a very good result, and it showed that the product was very effective at dealing with these cases of otitis. Turning our attention to the EU field study, here there was a positive control. So in this study, a single dose of Neptra was compared with the effect of a positive control, which was a product containing orbifloxacin, posaconazole, and memetazone, which was administered once daily for 7 days. Again, we had client-owned dogs with bacterial and or fungal otitis confirmed by clinical signs and cytology. In this study, dogs were evaluated on days 0, 7, 14, and 28. And as with the US study, each affected ear was given a subscore based upon severity, going from 0 to 3. And that again, as before, the total clinical score was the sum of each of the 4 subscores, and a total clinical score greater than or equal to 5 out of 12 was required for trial entry. And treatment success was defined as a clinical score of less than or equal to 3 out of 12 on day 28. And so a variety of criteria were assessed in this study, and here we can see some of these results as assessed at day 28. So firstly, the percentage clinical success, which is that reduction of the total clinical score to less than or equal to 3. Good result for both products, 87.4 for Neptra, 79.5 for the positive control, which is Positex. The percentage clinical relapse, where that total clinical score went up to 5 or above, then it was just 2.2 for the Neptra group and 3.1% for the Positex group. And there was also an investigator assessment where the investigator assessed the degree of treatment success. And those dogs that were deemed to have shown a good or an excellent response to treatment was 75.5% for the Neptra group and 60.6% for the Positex group. So it was possible to show that Neptra, with its single dose, performed as well as the positive control containing a fluoroquinolone, which was given daily for 7 days. And this study is currently in press. The abstract will be shared soon. That will actually be out hopefully in the next couple of weeks. Now, something that also people ask about is, well, do we have to wait until day 28? Do we have to wait until day 30 to see an improvement? And the answer is no. And here, again, looking at the European study, we have the clinical success as assessed at days 7, 14, and 28 for both groups. And we can see that even by day 7, then for the positive control group, it was 55.1%, and for the Neptra group, it was 58.5%. It went up by day 14 to 76.4% for the positive control group, 83% for the Neptra group, and finally, at day 28, it was 79.5% for Positex and 87.4% for Neptra. So this is what's called a non-inferiority study. We need to show the authorities that bringing this product to the market does not represent a backward step, as it were, and that it is able to, shall we say, hold its own in the market in terms of what's already there. And we can see that it was indeed non-inferior to this positive control product. And also what we can see is that we didn't have to wait until day 28 to see an improvement. By day 7, we could see an improvement that, over half the animals had an improvement of that score less than or equal to 3. So although the maximum response may not be seen, the maximum clinical response may not be seen until day 30, we know that we don't have to wait that long to see signs of improvement. So again, one of the other things, the other sides of the coin to assessing the efficacy is to assess the tolerance. Analysis included adverse events reported by the pet owner, and as before, few adverse events were observed, and these were not considered attributable to the study drug. And so it again was found to be well tolerated in a well-controlled field study on dogs with naturally occurring otitis externa. So we were able to show that this product, used once, a single dose, was non-inferior to our positive control product that was used on a daily basis for 7 days, and that therefore it is a worthwhile addition to what's available for those cases where we're seeing these common pathogens, Staph pseudintermedius and Malassezia pachydermatis. So what about features and benefits for Neptra? Well, what I'd like to do is to have a closer look at the active ingredients. And we have 3 active ingredients, as we said, in Neptra. We have our terbinafine, we have our florfenicol, and we have mometazone. Terbinafine is an allylamine. It delivers potent antifungal activity, and it has a different mode of action to azoles. So, for example, different to ketoconazole, fluconazole, and therefore there isn't a risk of cross-resistance, and we're delivering it in a high concentration. The glucocorticoid is mometazone furoate, and this is a very potent topical steroid. This is a list of the glucocorticoids that are available in ear products, and this is looking at the going from most potent to least potent. And we can see that at the top of the list, on a par with hydrocortisone aceponate, is mometazone furoate. Now, the great thing here is that mometazone furoate is described as being a new generation steroid or a soft steroid, in that it has a high level of activity, but it has a favorable safety profile. It has 7 times the potency of betamethasone, but has a favorable safety profile. So it's efficacy with tolerance. And we have florfenicol. Florfenicol is a niche antibiotic in companion animal medicine, and as I shall show shortly, it has good activity against Staph pseudintermedius. It's more potent than chloramphenicol, and it's not used in human medicine. It's used in a variety of formats in large animal medicine, but very little use on the companion animal side. It is not a fluoroquinolone, and best practice, its use to be based on cytology and indeed culture and sensitivity. Now, in 2018, WHO published a revised report on the critically important antimicrobials for human medicine. And they had different categories of antimicrobials. And the highest category would be the critically important antimicrobials. And here we find the aminoglycosides, so phromycetin, gentamicin, polymyxins, polymyxin B, and the quinolones, marbofloxacin, orbifloxacin. And then we have a lower category, which is the highly important antimicrobials. And here we would find the amphenicol, including florfenicol, and the steroid antibacterials, fusidic acid. So it's important to note that if we look at the antibiotics that are used, certainly if we look at the ones in the UK that are used in topical ear preparations, then 5 of them actually would align with that higher category with the critically important antimicrobials. Neptra, on the other hand, containing florfenicol, aligns with a lower category, the highly important antimicrobials. And we have a variety of products in the market. This is a picture of products available in the UK. We don't have Metamax, but it's one of the products that is available in a number of countries. These are excellent products. They contain aminoglycosides, fluoroquinolones, or polymyxin, and I won't say a bad word against them. The thing to bear in mind is that we now have another option. In terms of treating acute otitis externa in dogs, we have another option, and that would be to use Florfenicol instead of one of these other actives that align with the critically important antimicrobials. Now, I said I'd share some data about the efficacy of Florfenicol. An Italian study which was shared at the World Congress of Veterinary Dermatology, which is actually still ongoing. And this is an Italian study, and it looked at 600 strains of Staphylococcus intermedius isolated from the ears of dogs with otitis. And these strains were assessed for in vitro sensitivity to Florfenicol. And 99.3% of those isolates were sensitive. And of course, as we said, when we use a topical ear product, we are delivering our antibiotic at a high concentration. So hopefully, one can see that when it comes to these cases where there's staph, pseudointermediates, where there's Malassezia pachydermatis, we now have another very worthwhile addition to what's available. And the other thing to bear in mind, of course, is that when we use a topical product, we're delivering a high level of antibiotic locally. And looking at the European Medicines Agency categorization of antibiotics for use in animals, they have said that topical products such as ear treatments present the lowest risk of antibiotic selection. So we're using these high levels. We've got Florfenicol, which isn't one of these highly important antimicrobials, critically important antimicrobials. So there is some reassurance there if we do use this product. The next thing I'd like to look at is convenience. There isn't a huge amount of work looking at compliance in veterinary medicine. There was a study to assess compliance among dog owners. This is not specifically an otitis survey, but it was found that only 20 to 34% of owners gave doses at the correct time. And what does good compliance actually look like? Well, compliance will rarely be total, and it is generally considered that an 80% compliance rate is a reasonably good response. So from the outset, we're saying that 1 in 5 are not going to comply. And so the bar isn't set terribly high. So if we can do anything to improve that situation, so much the better. So compliance is a huge issue in veterinary medicine. We know that. And if we have a dog that's either aggressive or boisterous, treating it can be a problem. Trying to get drops down its ears can be a problem. And if this is the owner, no disrespect, but then that problem is going to be even more challenging. And again, we look at the products in the UK. We've got something that needs to be used 5 drops twice daily for 14 days. We've got something else that's 4 to 8 drops twice daily for 7 days. We've got one here, 10 drops once daily for 7 to 14 days. We've got another one here, 2 to 8 drops once daily for 7 days. So if the dog, as I said, if it's aggressive, if it's boisterous, trying to do that once a day, never mind twice a day, could be a challenge, and measuring the drops accurately could be a real challenge, particularly if we're asking this particular owner to measure out these drops and it's once or twice a day, and we've got a dog like one of these. Fortunately, Neptra is a bit of a game changer because we're not asking the owner to try and treat the dog. It's the vet. It's done by you in the surgery. So owner compliance is a non-issue. We don't need to worry about that. The product is vet administered or under his or her close supervision. And this is delivering convenience and compliance because it removes the need for the owner to treat the dog. So it's stress-free for the owner. It removes that risk of non-compliance, the missed doses, the poor technique, the underdosing, the overdosing, and of course that's going to give client satisfaction. You've removed that burden from them. In addition, the dog doesn't become ear shy because the owner trying to manage that once or twice a day, and it doesn't have an adverse effect on the dog owner bond. So, drawing to a close here, what are the conclusions? So we have this product with its 3 active ingredients, it's 1 ml of liquid and it's a single dose. And we know with a liquid, nothing's going to get into an ear more readily than a liquid. Case selection should be based on cytology. You look through the literature, that's what's recommended. It's essential to start with an ear canal. Not only do we need to visualize the canal and be able to see if our eardrum is intact or not, but we also need to clean it to allow the product we use every opportunity of exerting its effect. Time to reschedule a visit to recheck. Well, you're not tied to a particular time. It doesn't have to be 7 days later or whatever. It can be when you deem it to be most appropriate. So that could be 10 to 14 days later, halfway through the duration of treatment, really. So there's flexibility there. It's not for the most difficult cases. It's not for a chronic case or a pseudomonas case. We're looking at the sort of pathogens that you would find in the acute case. And we must never forget to look for the primary causes of otitis externa, because no matter how well chosen your product is, if you don't address these, then the problem may persist. And of course, the owner will perceive this as a product failure or whatever. And so we need to look at this in totality to see what's going on, what's making the problem happen, what's keeping it going, and obviously want to assess that and use our treatment as part of this joined up approach. The other thing is we're still at the moment dealing with the consequences of the COVID-19 pandemic, and we've just said about you have the flexibility to schedule the recheck when you think it would be most appropriate. But of course, we have a situation where actually restrictions on mixing and people going out, then it could actually be difficult for an owner to be able to bring the animal back to the surgery. So if that's not possible, at least you know if you've treated it that you've done it properly. And so if you're not relying on the owner to treat the animal, so if appointments are more scarce, people can't come in, at least you know you've given this animal the best possible start. Now, the other thing is, I mentioned about addressing those primary causes. This is a dog that's had a total ear canal ablation and bular osteotomy. Trouble is, this dog still has pruritus, and we can imagine how frustrating an owner would be if this dog had had quite extensive surgery and the dog is still presented because it has pruritus. And this would be suggestive that the primary cause of the otitis was some sort of allergy. So we may be looking at atopic dermatitis. And how frustrating for the owner that the dog has had this surgery, and yet there's still an issue where the pinna has this erythema, where there's pruritus. So we must always bear in mind the importance of the primary causes to the condition and the resolution of otitis. So why use Neptra? Well, the product is effective against the most common bacterial and fungal pathogens associated with otitis externa. It contains Florfenicol, it's not a fluoroquinolone. It contains mometazone, a potent new generation glucocorticoid, which gives us efficacy with tolerance. And last but by no means least, it contains terbinafine, an allylamine delivering potent antifungal activity. It's vet administered, or under her or his close supervision. It delivers convenience and compliance, and as we said, removes the need for the owner to treat the dog. Now, it should be used for acute otitis externa or acute exacerbations. It's not for the chronic, the difficult, or the pseudomonas case, and it shouldn't be reserved for the difficult cases. Just because it's new doesn't mean it should be reserved or used on that dog that hasn't responded to anything else. There are excellent products already out there which would be better employed for these types of cases, the chronic, the difficult, the Pseudomonas case. Refrigeration is not required, and as we said, the product is a liquid, and as we also said, nothing gets into the ear more easily than a liquid. So hopefully you will try Neptra, and we'll have a happy dog, a happy owner, and hopefully you'll be a happy vet. More information, of course, is available relating to Neptra. If we go and look at the SPC, and more information about the product is available there. And I'd like to thank you for your attention. Thank you very much, and goodbye.